And what are the early signs that they should be careful of, that they might be missing, or they are warning signs to them that, something is really wrong with them?
So what I would say is, generally as an eye doctor, once a child is about 3 or 4 years of age, before the schooling starts, you should have an eye checkup for your child.
And what is something that they need to know even before considering this LASIK surgery?
So the most restrictive thing that a person can have is fear.
Again, out of curiosity, what is the success rate for those who have got this LASIK surgery?
The success rate, what I have seen in my cases, have been more than 99 to 99.5%.
Wow. LASIK results don't last. Your vision comes back in few years.
False. LASIK is generally one-time permanent.
So in your conversation, you mentioned about ICL. What exactly is that? If you can simplify it for us.
So ICL is a procedure where a lens is manufactured based on size, shape and power and implanted inside the eye. Now we call this myopia. It's not just myopia, it's a myopia epidemic.
Welcome. We are glad to have you here.
Thank you very much.
So, to really begin with, from so many aspects that we've heard about eye health, and I personally who has spent 7 years in the education system, there is this one modern eye problem that I've heard from majority of the parents, and that is screen addiction. So, I would like you to share some insights on if screens are really bad, do they really damage, or is it just overstated?
So the two things that you should understand here is, one is the bad and the damage. Yes, screens for a long time do cause distortion or are not good for your eyes, but there's no physical damage to the eyes. It doesn't damage your cornea, it doesn't damage any structure of your eye or the major retina nerve of the eye, called as a retina. But yes, it does cause something called as strain. Now what happens here is your eye becomes tired. There is drooping of your lids, means the eye becomes heavy, the eye becomes red, there is watering, there is burning sensation. Now these are called as digital eye strain, or previously called as computer vision syndrome. This is very commonly seen in children or even IT professionals who are on screen for long hours of work without a break.
I agree to that. So, because I personally also come from that space and long desk hour jobs, I think it gets very difficult. So, because we are on that segment and I'm sure most of our parents are watching us, right? So, for them, when should the child first see the eye doctor? And what are the early signs that they should be careful of, that they might be missing, or they are warning signs to them that, something is really wrong with them?
So what I would say is, generally as an eye doctor, once a child is about 3 or 4 years of age, before the schooling starts, you should have an eye checkup for your child. The child might not know whether his vision, what he is seeing or she is seeing, is normal or abnormal. A person can know what an abnormal is only if he knows what is a normal thing.
Okay.
So a child, for example, if you're seeing your child is having problems with reading, or if he's going very close to your television or screen time, or if the phones are very close to his eyes, there is less of physical activity. Or if the child is already going to school and you see that he's not concentrating too much in the class, then it might be that he might have some power or glasses. It's a cue to go to the eye doctor and have an eye checkup done.
Okay. I mean, that's pretty early when we talk about it. So then, I'm a little curious now that you were talking about they get eye checkups done, and if they have power, they use glasses. But then, does that mean that their eyes are really weak if they get glasses right at the early age?
So wearing glasses doesn't mean that there is a physical damage to the eye. No, it's just that the eye needs an aid to see clearly.
Right.
The use of eye is only one, to make your vision clearer. Correct. If the eye is not able to see clearly due to a mismatch in the size and shape of the eyeball, that's why we have the power to be worn. To use glasses should not be an issue. See, wearing glasses doesn't mean that the powers will not increase, not decrease, or stay the same. The use of glasses is only one, to make your vision clearer. And if the child requires the glasses to have a clear vision, then he or she should wear it.
Okay.
If the child does not wear the glasses, or if the parents or the family members think that wearing glasses would make the problem worse, they are wrong. Wearing glasses is good, but not wearing glasses can be more problematic. There's a condition called as an amblyopia or lazy eye, in which the nerve maturation doesn't happen properly if the glasses are not worn, if the glasses are required. These are irreversible problems which can happen later in life. The child, because has a very good chance of recovery with the glasses. If it doesn't wear, then the vision can come down permanently. This can happen up to the age of 6 or 9 years. Beyond that, even if wearing glasses for a long time, might not increase his vision.
Okay. So what you just shared, I picked up something from that. The recovery is needed, and for that you need to wear glasses. So I'm curious, for those who have got glasses, once you start wearing them, are you sure that there is a system of recovery, or it's a lifetime thing that they need to wear? Because that's what my assumption has been.
So I would want to describe or define this, give a part of answer in 2 parts.
Okay.
First is the growth phase or the child wear. Okay, now during this time, yes, the glasses are the basic requirement. Okay, there are many new advanced therapies or medications which are there, which can help control the power or even slow down the retardation or slow down the growth of the power. Okay, these are eye drops. Okay, these are some therapies like red light therapies.
Okay.
And there are some lenses called as ortho-K lenses. Now these help you to control the growth. Nowadays, we have recently also got an FDA approval for one of these glasses called as Myopia controlled glasses. Okay. Now there is this company called Essilor. Now they have a lens called as Stellest. Okay, and another lens from Hoya called as Myostab. These slow down the power with which the growth happens. So this, if given in children, the power growth can slow down. So instead of, let's say it was going to 6 or 7, can stop at 3 or 3.54. Now that's a huge number.
Right.
And now there are many studies which have shown to be significantly good. Okay. So this is that. Now this is for seen in children. Now when you come to the adult part, when they're gone beyond a teenager, 16, 18, 20. Now yes, if the power, during that time the power doesn't grow. Your growth phase of the body happens till 16 to 18 or beyond that, it doesn't grow.
Right.
After that, we have options of refractive surgeries like LASIK, PRKs, or if the powers are higher, we have ICLs. Now, these are great form of surgeries or procedures which will get rid of glasses permanently.
Okay. So now that we are on LASIK that we were talking about, because I'm also someone amongst that crowd who has been considering about LASIK since very long right now. So I've thought about it. I personally also have a very low power, like 0.75 and 0.5. But I have always feared if I can get that surgery. So my next question is on that what do you think people are most afraid of, who have been thinking of getting it done but have not got it done yet? And what is something that they need to know even before considering this LASIK surgery?
So the most restrictive thing that a person can have is fear. Right? Because it's a surgery or it's a procedure after all, and it's a surgery on your body. You are going to be restrictive for that, and it's on your eyes. So definitely, yes, there is a concern which happens, which is seen generally. And yes, we do see a lot of patients and people coming up to us and saying that I am considered that, but the only thing is it's a surgery. I am skeptical. I am afraid what to do. So yes, see, any procedure which is done on your body will have a part of fear in this. But you need to understand that science, technology, techniques have gone so advanced that there are procedures so safe and so fast recovery that you will hardly know that something has happened to your eyes.
Okay.
Now, the technique of LASIK is so fast that within few seconds or half a minute the surgery is done. Okay. Now there is another new procedure which is called as a TransPRK or PRK. Now where we do not touch your cornea at all with the help of any machineries. Okay. No blade, no flap, no cut, no touch. It's an all laser procedure. Right. Here, based on the power, the laser time can be anywhere between 10 seconds to just 60 seconds. That's less than a minute per eye. And you just walk in and walk out. Now, coming to the one which was saying as a power, yes, generally we see that the power up to 0.5 and below, we generally avoid not to do. But 0.5 or 0.75 and beyond are definitely a procedure at thought. Okay. The lower limit, yes, 0.5 or 0.75 can be done. Upper limit can be anything. Based on the cornea, the black part of the eye, that's called as cornea. Now, based on the curvature, the thickness, the power, when we do the pre-LASIK evaluation, we come to know whether you're suitable for the procedure or not. And if yes, which kind of procedure you're suitable for. The laser procedure or the lens-based procedure.
Ah, okay. Because I think I also heard, maybe it's a myth now that I'm hearing from you. I was told that people who have 2.5 and above as a par are the ones who are eligible to get this, LASIK surgery. But I'm so glad to be hearing this. So, because you mentioned a lot of procedures in between, so maybe if you can walk us through the complete experience, right from, say, booking a consultation at Solanki Hospital, say, for LASIK surgery, to the day when we walk out with our glasses. So, if you can walk us through, please.
So when you take an appointment and visit us, so we will first have a complete examination of both your eyes. Right? We will first do a pressure check in your eyes. We will check the power of your eyes. We will check how the nerve inside is. We'll put the drops and examine you. Before that also, when we give you a small information what the procedure is about, or what your expectations are, what will the actual outcomes of the procedures, because your alignment with your understanding is required. So we do a pre-LASIK evaluation. So in that, what we do is we do the corneal topography. Now this is a test to see the curvature and the thickness of the cornea. In other words, it's mapping out, okay, the cornea, whether you're eligible or not. We also do something called as a dry eye evaluation. Now there is a thin layer of tears or water on the eye, which is called as a tear film.
Okay.
Now, is this healthy enough or not? So based on that, these two tests and the power of your eye, we see whether you're eligible or not. So the three basic criteria that we see here is age beyond 18 to 20. Second, power to be stable for 6 months to 1 year. Third, the test which I just told, the topography and the dry eye evaluation to see your stability and the thickness of the cornea. So these three tests will be done and told to you whether you're eligible or not. And based on that, we give you the options, either LASIK or PRK or ICL. Now coming to the LASIK part, your appointment is fixed. On the day of the surgery, you just walk in. Okay, and we will do a pre-evaluation again to see your power of the eye, and then you're in the OT. The walk-in of the OT is just about 2 minutes. Okay, you come in, we just cleanse the eye with a solution. We put an anesthetic on the eye to numb the eye. Of course, eye being the most sensitive part of your body, you will not. No one lets us touch the eye, so we put the anesthetic drops in the eye, and then the laser is done. Now, in procedures like PRK or TransPRK or TPRK, the laser is fired, and within few seconds, maybe 10 seconds or 20 or 30 seconds based on the power, the surgery is done. And then you walk out. So on an average, it takes about 30 to 50 seconds per eye, and in and out of the OT, a person can expect between 3 to 5 minutes. Now you walk into the OT, you walk out of the OT, and after half an hour or 45 minutes, after the medications are instilled in your eye as an antibiotic, there will be some painkillers which will be given, and we'll be explaining you the do's and don'ts. And then you walk out. And next day, you're almost clear.
Oh,
So that
sounds pretty
so the whole time, if you're in the hospital during the day of the surgery, might not be more than 1.5 to 2 hours.
impressive. So, because I only knew about LASIK, right? You also spoke about PRK and TPRK. If you may in layman's language where my audience can understand, what exactly, how are they different?
So LASIK is a procedure where you make a cut in the cornea. Okay. Cornea is the black part of the eye, which is the first structure of the eye. So you make a cut, you raise the flap, put the laser on, treat your power, and close the flap. So that's the procedure for LASIK. In PRK or TransPRK, the skin of the cornea is removed either manually or through the laser itself, and the laser is fired immediately. So in the LASIK, you are lifting the flap and closing the flap. In the PRK, you're not doing anything. You're just putting directly the laser on, and the laser does everything. That's why we say this is a no-touch technique. In everything else, you are touching the cornea with an instrument, with a blade or with another laser. Whereas here, you're not doing anything. So that's why the surgical time in these procedures is the least of all the laser available.
Okay, interesting. So then, if I were to ask you from a little finance angle, because I've heard a lot of people also say who have considered this, that, LASIK surgeries are usually a little expensive. So if you can throw some light, what is it like when it comes to financials for people who are considering this?
See, these are cosmetic procedures, right? So based on the power we do, and yes, these are laser which are advanced. So the cost is a factor here, being in this geography. But then the outcomes and the longevity is the longest. It's high. So for example, let me run through this. If a person is wearing glasses, and on an average, if he changes glasses every 1 to 1.5 years or maximum 2 years, the cost of the glasses with the frame might be anywhere between 5,000 or 7,000 on an average, right? Now, when you're on the screen for long term, then you need to have anti-glare coating and anti-fogging and all dusting it out. So that can go up to 10,000 or so. So every year or every 2 years, if you're changing, this multiplies.
Correct.
Right? And if you're wearing glasses when you're going outside for your picnic or vacation, you would want to wear goggles, right? So you make powered goggles also. Now that again becomes costlier.
Cost, right?
Okay. Or if you're going for some function or events, then you don't want to wear glasses, then you wear contact lenses. So when you put this, there are recurring costs which comes. Now all this cost can be just put in one thing, one cost, and the surgery is done. The cost of the surgery can vary from place to place, but in ours it's about 55,000 for both eyes, and that's one time permanent. So if you're getting it done at around 20 or 22 years of age, for the next 50-60 years you don't have to think anything about it. So yes, it is a one time cost, but then the effect of that stays for long. Okay. Now procedures like PRKs, other places could be very high, but in ours it's quite low. There are specific procedures like Smile and Silk. Now, these are quite costly because the machinery is costly. That's why they can go anywhere beyond 1.25 or even 1.5 lakhs. Whereas this is just 1/3 of it. And the effect of this is the same. So, the cost, yes, initially when you hear it might be a bit factor, but then you multiply it to your daily usage. This is a minuscule of a number for a long term.
Definitely. So then all of these surgeries are covered in insurance, people who have it, like how does the insurance policy really work in this?
So as I told you, my first statement initially was these are cosmetic procedures.
Right.
Now, insurance will not cover this as a cosmetic procedure. So generally, no, it doesn't cover. But yes, if the powers are quite high and if your insurance policy has been informed that or says that it is eligible, or covered, then yes, it is there. But then that has to be verified with your policy. There is nothing that we can do in it. If the policy says the procedure is covered with this power or X power, then it will be covered. Otherwise, no.
Okay, perfect. So, again, out of curiosity, what is the success rate for those who have got this LASIK surgery or PRK, TPRK surgeries?
We have been doing from more than 18 years, and I have personally been doing more than 10 to 12 years of these lasers and PRKs. The success rate, what I have seen in my cases, have been more than 99 to 99.5%.
Wow.
Now, this is one of the highest what we have seen. Yes, I can say it is more than around 99.9 also, but then I'll be very realistic because the expectation has to meet the reality and natural. So, this 0.5% are the complications, or no, nothing of those. No one has had any major complications or any issues. It's just a delay, that's it. So in that way, has anyone come back to me saying that my powers have come back, I'm not happy with the outcomes, or there is any other complications? Till now, no. So that's what my track record is.
Very impressive. I think then I'm soon gonna see you for my pre-evaluation of the surgery then.
Glad to have you there.
So there has been so much information and wisdom that you have shared from your career and experience that you have been part of. So I'm very curious of knowing how many cases have you handled so far? Like what is the highest?
So I've been practicing in our hospital at Dr. Solanki Hospital for more than 15 years now. Right. So if you say in total, I've done more than 54,000 eye surgeries.
Okay.
Now this includes cataract surgeries, pterygium surgeries, ocular surface surgeries, LASIK and refractive surgeries like PRKs, which has been about 7 or 8,000 plus. Okay, and ICLs, where I've done more than about 2,500 plus surgeries. These are all till date and counting. And I hope to reach good outcomes with satisfied and happy patients for more longer.
Lovely. So then, if I were to ask you, how many patients, like in number, what's the number of patients that are in touch with Dr. Solanki as of today?
So our testimony is that most patients who have got operated up at our hospitals have always been well-wishers and have a good follow-ups. Now, a patient who comes back with a smiling face is a patient who is good outcome. Okay, we always see that the patients are followed up from our staff at the hospital for to see if there's any issues they're having, post-operative outcomes, if there are any issues, how is any problem related to their insurances or any other post-operative medications issues. So the follow-up has always been good, and the patients have always been giving us a good outcome, both as a surgeon with their outcomes and the attitude or the response from the staff and the courtesy of the staff has given to our patients.
Impressive. So, because you mentioned a lot of surgeries that you've been performing or Dr. Solanki Hospital has been performing, what is the highest PAR that you have treated so far?
So, when coming to highest PAR, there's one patient whom I had operated with the power was minus 32. The glass power which came was minus 32. Now you can think with a power of with power of minus 2, the person has difficulty in having a normal work. With the power of minus 32, is practically blind. Okay.
Right.
But yes, this patient also had a weakness in the retina, so the outcomes were very limited. But then the person was so happy that he was all free. He didn't have any issues. So the outcomes of such patients are also seen. Now in this patient, I did an ICL and the outcome was excellent. We had to make a customized lens for this patient so that you can see clearly, because with powers of minus 32 which is wearing, these are not readily available. So we had to get. There's another patient where I have done with a plus 8. Now generally you see that powers are in minus. Okay. Pluses are lesser, but then you have plus 1, plus 2, plus 3. Plus 8 PAR is not so common, and those patients are really, you see the thick glasses. Isn't it? You see, like, you would have remembered the Babu Bhai from Hera Fairy.
Oh, yes.
Yes. So now those are plus glasses. Okay. Now think of patient wearing these kind of glasses. I've operated these kind of cases also, and they have been such good outcomes that patients give us a testimony that this is a procedure of choice for every person who has glasses.
Okay, so then would it be fair for me to say that so far at least -32 and +8 can be treated at Solanki Eye Hospital?
Anyone with any power who is eligible can be treated in our hospital, be it +8, +4, -2, -5, -10, -15, -20, or -25. Yes, generally we see around -2 to -20.
Okay.
32 is one of those rare cases,
Yes,
but yes, but then any power with this technology which we have can be done.
Perfect. So in your conversation, you mentioned about ICL. What exactly is that? If you can simplify it for us.
So ICL is a procedure where lens is manufactured based on size, shape, and power and implanted inside the eye. Now this procedure is given to a patient where laser of any form, be it LASIK, PRK, SMILE, or silk, cannot be performed. Okay, be it reasons like high power or severe dry eyes or any other eye problem which are there. And this procedure is very safe. It takes about 2 or 3 minutes per eye. Recovery is within few hours or a day, and 3-4 days back to work. So these are implants, like lenses which are implanted inside the eye.
Oh, interesting. That sounds like
It's like
customized solutions.
yes, so it's like contact lenses, different shape but put inside your eye permanently. Yes, it is a surgery, nothing to be scared of. The eye is numbed with an anesthesia, and it takes about 2 or 3 minutes per eye.
Okay. So, because we spoke about LASIK surgeries, we have spoken about PRK, TPRK. We also spoke about, the screen damage, especially for the younger age group that we are talking about, right? So, we came across myopia as a term. I would want you to again simplify that. What exactly is that in simple terms?
So myopia is a condition where a child needs aids in form of glasses. Now, if the child is not wearing if the child is not able to see clearly, okay, he requires glasses. Now, these glasses can be minus powered or plus powered. The minus powered glasses, which is more commoner, is called as myopia.
Oh, okay.
So, in this condition, the child will not be able to see the distance vision clear, but he'll be able to manage his near work because this is clear. But for distance, his vision is blur. Okay? So for this, he needs to wear a minus powered glasses, and this is what is called as a myopia condition.
Okay. Then, for our parents in the audience who are listening to us, what do you think is a right age for a child to first see a eye doctor? And what are the eligibility criteria for them? Like, what are the early signs for them to know that, yes, there is something wrong with them?
So what I say is, at our hospital, anyone who is at the age of 3 or 4 years should get their eyes checked once. Okay. A child of age 3 or 4 years should get it done, because the child will not know what is an abnormal vision. So you can compare an abnormal only if you know what is normal.
Okay.
The child might be showing some symptoms or signs that he's not seeing clearly, but most of the times parents or elders at home ignore them because they might be thinking that child is just playful, he's just taunting us, or he's just teasing us. So they might actually missing the important signs. Now, what are these important signs? First, if he's not is not responding properly to your commands. Second, if he's going very close to television to see. Third, if he's keeping his digital devices very close to his eyes. Fourth, if he's unresponsive in his classes, means the teacher says, when I ask him to look at the board and read something, he's not reading. So the teacher might be a guide here. Fifth, you will see that his class workbook has a lot of spelling mistakes.
Okay.
Right?
Okay.
So these are one of the causes that he might have. The child might also keep on rubbing his eyes frequently.
Right.
There's frequent redness or even watering, or if the child says, I have headache, okay, or heaviness. So these are all some of the conditions or causes or the problems that might have. It doesn't mean that these all have to be there. It can be a combination or an individual problem that we see.
Okay. And I think then parents should really be observant
So
sometimes.
one other point along with this is that if one of the parent has glasses or both the parents have glasses, there is a good chance or a higher chance that the child might also get.
Right.
So earlier detection, better the vision.
Vision, definitely. So now that we were talking about, glasses, children, parents, if you can share any case study in this area where you would have come across any parent and a child where it has been very difficult to really work on the vision of the child, but somehow you've been able to work on it and bring a difference to their life.
So working with a child is not always so easy
Ah,
because the attention span with a child has is very less. And if the child doesn't like it, he might not even cooperate.
right.
So this takes not one visit, maybe 2 or 3 visits. Now this time we always tell to our patients and their parents that patience is what you require. Okay, you need to have some time. Give us some time so that we can connect to the child, get his or her confidence, and then start treating them. Let's say the child has a power. Okay, there was this one, what I can remember now is this very young girl. Okay, she was very sweet. She was normal. She was doing all her routine activities, but one fine day the parent noticed that she's seeing very close for the phones and going very close to the television. Her routine activities at home were good. So the mother just thought, let me have a eye checkup because she herself was wearing glasses and got a laser done quite some time back with us only.
Okay.
Right now, the mother got the child here, and then we examined. We said that she also has a power. Now the power, when we checked, came to around minus 2.5 directly. So she was a bit in a shock, saying that how could she get the power so early when I got it at the age of 12 to 15.
Right.
So the power doesn't come looking at the age. It's a genetic. One of the strongest factor for this is genetics. So that's why I said parents having glasses, you should get your child checked sooner. So if the glasses are there, then we give the glasses. The child has to wear, and this child improved in vision. Initially, when we checked, she was at least 30% less than a normal person. Now over years, the vision has come to almost 95% now with therapies and glasses. So yes, I can say that in our hospital, what I did for this child has improved her vision, could make her career more profitable, more career worthy lifestyle. So these are things. The only thing is proper understanding, proper follow up, and patience is what the elders or the patient's parents should have, because this in children, time is what we ask.
Right. Just to know, how old was this child?
She was about 3.5 years.
Oh, pretty young, I would say. So that means parents, you should definitely be very observant about your children and get your children as early as possible checked with the doctor.
So I would say that here also that. So this child who came up, this child who got examined and So this child who was started wearing glasses, her vision improved from 70% to 95% in just 1.5 years. So that's when I said that patience is what we require from parents. With the present day therapies and medication that we have, the vision improvement is very good. Yes, majority time it does. Sometimes it might not be so much, but then yes, with evolving technology, the outcomes are really good. So I would say that at the end for this, patience is what we require from the parents, and time is what we ask for.
Right. So, because you shared that, this is genetic, hereditary, if especially both parents have it, younger children are expected to, have the same. So then what does the future generation look like? Like pretty much everybody today wear glasses. I mean, majority of the population.
Yeah. So To give you a statistics, I'll just start with this. There was a study which was done by WHO, that's
Okay.
the World Health Organization, and this was published about a few years back. Now, the research which came out was kind of shocking for us also.
Okay.
Now, we call this myopia is not just myopia, it's a myopia pandemic or myopia
Wow.
epidemic now.
Okay.
So, the study shows that the Southeast Asia region, which includes India, China, Myanmar, Philippines, Indonesia, so that whole Southeast Asia region also, the prevalence of myopia is going to go high in the next 20 years. So by 2050, about 50 to 55% of the population is going to be wearing glasses with minus power, called as myopia. Now, this is very shocking, It's not that we see very common that these kind of problems increase in such a short time. Okay. Now, the same study was also similarly seen in diabetics, where again we saw that Southeast Asia region, the diabetics is going to be increasing. Now, we have seen that even myopia prevalence is going to be increasing so much. So the right time to have your eyes checked for your child is around 3 to 4 years or earlier, based on if you're seeing any problems,
Right.
like squinting of eyes, or eyes a bit smaller or shorter, or the child is not following your movements or any lights, then these are cues that you should get the child's eye checked up with the eye doctor or with us.
Right, right. So then I think it becomes very key, not just for children, but even for adults to be quite mindful of what their eye health looks like, at least in today's time. So, because we were talking about LASIK and its surgery, it would be great if you can share what is the eligibility criteria to get a LASIK surgery done.
So the criteria are long, but what I would say is there are 3 points that you should know. First, age beyond 18 to 20.
Okay.
Second, power to be stable for 6 months to 1 year.
Okay.
Third, we do a pre-LASIK evaluation to see the curvature and thickness of the cornea, the black part of the eye. Now, these 3 conditions, if it's fulfilled, then the eligibility criteria opens up. Yes, few conditions where you are eligible, but we say that you're not eligible now, but after a few years or some time, is one specific conditions for pregnancy, okay, or a nursing mother, means you're feeding a baby. So during those times, because there are a lot of hormonal changes, so we avoid during that time. But after weaning period of 1.5 to 2 or 2.5 years, if your eyes are eligible, you can get the laser done. So these are the criteria which you should know.
Perfect, perfect. So, because we spoke about genetics, hereditary, how mindful every adult today should be, because this is what you're even passing it on to the coming generation, right? So then, Bangalore being the IT sector, a lot of desk job, and not just desk job, but the kind of exposure they've got to the screen as well. What is that one thing you would like to share from your end about the eye health to these young working professionals of Bangalore? And also, what would you suggest that they stop doing and stop ignoring about?
So in the present day generation work, we see a lot of IT professionals working for 10 hours and 12 hours, or even few people say 14 hours. It's actually much more than what even we think now we do.
Right.
Okay, we have a long hours of work, but I think regularly IT professionals are now going beyond their time. So that takes a toll on your body and also your eyes. So you're very much, your eyes are very much strained out. Now this is called as computer vision syndrome or digital eye strain. Now we call that. So the 5 things you should remember that you should do to avoid this or even prevent this. First, the 20-20-20 rule. So after every 20 minutes, take a break of 2 minutes or 20 seconds. Okay, focus on a distance for about 20 feet. So this helps to relax the muscles of your eye. Second, blink frequently. So the blink rate naturally should be about once in 3 to 5 seconds. Now when you're on screen, the blink rate comes down very low. It's to 1 in 5 to 7 seconds or even 8 seconds.
Oh.
So, in other words, in a minute, it should be about 16 to 18. It comes as low as 8 to 10 per minute. Now, what happens here is if you're not blinking, the tear film gets thinned out and it breaks up. So, it's not stable. It's unstable. So, this can cause dryness. Third, if you are in an AC room or if you are sitting beneath a fan, see to it that the flow of the air is not in front of your eyes. It evaporates the moisture from your eyes, leading to dryness. Fourth, do not keep the screen brightness too high or too low. It should be according to room lighting. That will cause a lot of strain on your eyes because light going too much in your eyes will cause sensitivity issue. Fifth, do not keep the font size smaller. Keep it larger. What I see most common in people of IT professionals are they keep the font size smaller so that everything is in one screen. You don't have to scroll, okay? Or everything is in tablet or phones. Now remember, increase the font size. The standard font size which I advise to keep is 14 to 16, so that the strain on the eye is lesser. Scroll if you have to scroll. Keep your work from laptop or your phone to your desktop to a 21-inch monitor. That's more easier to your eyes. It's very less strainful on your eyes. So these are the 5 things you should remember. 2 additional small quick bites which I would give here is do not switch off your lights and do phones at night. Okay, because now phone is something which is your personal time. So you switch off your light and do phones, which is not advisable. Second, the smaller the screen, more the strain. Right? So if the screen size is small and everything is the strain on eyes, you do this and see. When you're squeezing your eye, understand this, that there is something happening in your eyes. This is a reflex which is happening, which is not a good sign. Right? Now, initially, maybe when you visit, we might give you based on what the problem is, an artificial tears or lubricant drops, but based on the severity of this dry eyes or the digital eye strain, we might tell you the proper procedure, the do's and don'ts, any other therapies that are required or any other glasses addition required.
Well, I think all the points that you said, I think easy 90%. I am doing the opposite of it. I personally, then I'm sure that the majority of the audience are in the same boat that I'm in. And I think it's high time that we realize that it's important that we focus on it as well. This segment has been quite insightful, not just for my audience, but also for me personally. So thank you so much, Dr. Priyank Solanki, for your insightful, not just the technical segment, but also personally connecting to what each one of us as in our general life we might be facing. So if you're anyone like me, trust me, you have probably ignored your eyes more than you should be doing. So I think it's your high time that you look at it, take care of it. So today is actually the time if you think you or your loved ones have been putting off your eye checkup or have not looked into your eye health, now is the time. Book your appointment at Solanki Eye Hospital and please take care of yourself. The link is in the description. I will see you in the next episode.